Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to We Talk Health, part of West Tennessee Healthcare's podcast. This is Cathy Sudbury with Work Plus Rehab. We are on the road to recovery today, and we are traveling to Jackson, Tennessee to Work Plus Rehab Center. And today I have two of our occupational therapists with us, and I'd like to introduce them. One is Cody Stovall, and the other is Tatman, and we will be talking today regarding the adaptive driving program. Woody, would you like to go ahead and introduce yourself and tell a little more about yourself?
Well, my name is Tatman, occupational therapist. I've been working here at West Tennessee Healthcare for the past 31 years, and I've done a variety of things as far as inpatient rehab, and I've been doing the driving program since probably 2008, 2009. Been involved with Work Plus since then.
And Cody, how about you?
Good morning. I'm Cody Stovall. I've been an occupational therapist for roughly 10 years, so I'm the younger statesman here in the group. Also a Certified Driving Rehab Specialist. Do a lot of things here at Work Plus. Obviously today talking about our driving program, but we do a lot of work hardening, hand therapy, a lot of different things like that. So a varied experience here at the clinic, trying to get people back on the right track, back to work, back to life, things of that nature.
So a lot of people don't realize Work Plus has that many different divisions in it, from physical therapy and occupational. But one of the things we're going to talk about today is these two are certified in a specific thing, and I'd like for them to explain what that does and why it's so encouraging for you to know what adaptive driving means.
There are very few of us around the country that do this. There's about 300 certified driving rehab specialists in the country, and it's a very important service because if you think about the lifespan from when we begin driving, maybe you're 15 or 16. If you're like me and you live in the country, it was 7 or 8 years old. I got on a tractor and learned how to drive. A lot of people don't have that education or that background to begin driving, and maybe they have a medical condition that keeps them from driving safely, or from their parents from teaching them to drive. They might have autism or have cerebral palsy or have something like that could cause them to be a little bit more difficult to learn how to drive. And then so you go from that age in the 15, 16, 17, 18-year-old range to your young adult who might have some sort of disabling condition or accident. So they might have had a car accident, had a spinal cord injury, and now they've driven normally for a long time. And now life has changed, and they have to drive with something such as hand controls. So that's something we teach. And then you look at the older population as we age, and sometimes mom or dad, their condition changes, and maybe their memories change, maybe their ability to get around, their mobility has changed, and maybe their safety has been compromised in that way. And so we assess them through that. So Woody may talk a little bit more about the actual assessment process, but that just kind of talks about the whole lifespan from learning how to drive to sometimes at the end of life, seeing if we can still drive and be safe during that elder period of our lives.
And sometimes it's not really the end of life. It can happen really any time when you should or shouldn't be driving, depending upon your disability, what's going on with you. The early Alzheimer's, we've had people as young as 52 to where we've said they couldn't drive anymore, and they weren't very happy about it. So, but Cody and I are the one of 7 in the state of Tennessee that even are certified through the National Association Driver Rehab Specialists to even do this. It's a lot more fun helping somebody that has been disabled for some reason, whether it's a spinal cord injury or what Cody was mentioning, and teaching them how to drive again with a modified vehicle. So we're not really teaching them how to drive. Having somebody that shouldn't be driving is probably more critical, because you're trying to save and preserve their integrity as well as their life, and then other people's safety. So it's a community safety issue, which is pretty much paramount. And we try to explain that with our patients on the front end. And so after we evaluate them, which is a pretty intensive 3 to 4 hour process, we spend some time in the clinic discussing, going through some reasonably simple cognitive assessments, and then we, for the most part, take them on the road. And so we just see how they do. And then we provide them that information, and then usually give them some information about what they can use within the community if they're no longer safe to drive.
You touched based on two things I wanted to ask, though. When you say you're certified, and two right here in West Tennessee, out of the state of Tennessee, there's 7, and you're 2 of them, correct?
Correct.
And what that means to the general public is that you guys can make the yes or no decision on whether or not this person is able to drive. And then if they are able to drive, you're able to help with teaching them the modifications in the vehicles we have that have some maybe hand gear or
left foot accelerator.
Exactly. So we have those two. We have 2 vehicles here that were able to do that, correct?
We do. And we provide the training as well. And so Cody and I both do that. Tomorrow we're actually going to help somebody get their driver's license. Been working with as a spinal cord patient. So that'd be pretty exciting. I think he's pretty excited about it.
Yeah, and right now we've got a really exciting thing going on. It's been going on for about 3 or 4 years here with Work Plus and partnership with the state of Tennessee, the Tennessee Highway Safety Office. We have a grant to assess folks who are 65 years or older who have some sort of cognitive condition. So it could be memory loss, it could be any number of things that their physician has some concerns about their ability to drive safely. And through that grant from the state of Tennessee, we can actually do the assessment at no cost, as long as they meet the requirements of the study and agree to share their research. Because believe it or not, West Tennessee is a very dangerous place for folks in that 65-year and older category to be driving. There were some statistics that came out back in 2016 that showed that Madison County was ranked in the top 5 counties in the state for that age group as far as deaths. So that's really one reason we're trying to get ahead of this curve, trying to protect the citizens, especially that age group, and get the word out today that, if you're having issues, whether you're someone that may be having some things going on in your own life, or you're thinking about mom or dad right now, that, hey, something has changed. We don't really know exactly what that is, but something is really changing with them, or it has changed, and we're concerned. Some of the best advice would be just to speak to your doctor, talk to their physician, their primary care doctor. If they've seen them for a good while, they're going to be able to see some changes as well. And a lot of times, just mentioning that in that visit can really start the ball rolling to keep them safe. Great piece of advice today, just to start that conversation, because when things in life change, the quicker you can have that conversation, especially when it comes to memory loss or Alzheimer's or dementia or something like that, starting that conversation on the front end really, really helps the process go more smoothly.
So our evaluation process, I kind of was alluding onto what Cody was saying, having the conversation with family members and your doctor, but our process is very objective. So a lot of people are concerned that you're picking on me, you're taking away my right. Our whole process is, like I was mentioning, very objective and very thorough and just kind of rather efficient. We're not expecting perfection, but just to be able to make some good quantitative decisions, smart decisions, and then drive safely. I really try to emphasize, I think Cody does as well, that the whole driving process, when you go out and drive, it's all about trust. You're trusting that everybody's going to play by the rules. And when you have a memory loss issue or some cognitive thinking issues, then making those decisions on the road gets rather challenging. When to pull out, what side of the road to stay on. And we've all had this person that's been traveling eastbound and they're headed west. Or coming up the on-ramp when they should be going down the off-ramp. And so we try to be as objective, and we do. We're very objective in the whole process. So basically trying to keep everything safe.
Yeah, and that's a good point, Woody. I think another reason that we're here today, too, is a lot of times when someone comes here to be evaluated and let's say they bring a family member, a daughter or a son with them, a lot of times that daughter or that son is so frustrated. They're just so strung out at that point because they've taken care of their loved one for so long, and they didn't know that our program existed. And when they get here, I can't tell you how many times I've heard, I wish I'd known about this a year ago, because mom or dad they have needed this for a long time. And I guess that's, like I said, one reason we're really here today to try and continue to get the word out that you're not alone in this. You're not out on an island. There are a lot of people dealing with this. A great example, yesterday, I evaluated a lady. She was in her mid-80s, and I knew I recognized them. And actually 2 years ago, I evaluated her husband, and he had Alzheimer's at the time. And we just kind of talked back about that case and how he's doing, and he was recommended to not drive, and he's doing well and living in a facility near their home. But I just look across the table at the daughter, And it gives me peace knowing that we were able to help her transition, and her mother and her father transition to a safer life, because it was obvious that just like her father, her mother did not need to drive due to the testing that we did. And to me, that's a huge success story. Is it sad in a sense that mom and dad aren't driving anymore? Sure, it is. But on that same coin, you flip it over and mom and dad are safe now. And there's not that opportunity for them to go out and get into a situation that they can't control because they don't have the cognitive ability to do that anymore. So that was just a really good example of how, this program can, come full circle in one family. And that thankfully that doesn't happen often, where a husband and a wife, need our services. But I know it gave the daughter a lot of peace. And even when we were discussing that with mom yesterday, she was accepting of it. She knew there were some things going on that had changed, and she just really wanted to see if she could still drive. So just a great success story for what we do.
And it seems you're also playing that role of peacemaker between the doctor and the family members, because myself, I have aging father and mother, and just knowing when that time comes, how hard it's going to be for me to say, you can't drive anymore. Knowing that there is that third-party person that can make that decision and have the proof to say, Mom, sorry, you just can't do it. And it kind of takes the role of being that punisher, as you might want to call it, into y'all's hands. And you guys make that decision for them. You also do relay this back to the physician as well, so the daughter doesn't have to go back and tell the doctor this. Is that what the process?
Yeah, we send the information, and the report goes to the doctor for their clarification. And then we also notify the state. The state gets a formal description and outline, and then the state actually notifies the individual of the status of their license. So we tell the folks that from our perspective, they did not, I hate to say the word fail, but didn't pass. We don't feel that they're safe to drive a car anymore. And then we will notify both their physician and the state, and then they will be notified of the results of that, pending that. But pretty much what we say the state does go along with. I don't think I'm not aware of anybody that's ever been, it's been disputed, but sometimes we've had people where they've come back and they've been retested, or they've been tested somewhere else. And so once they fail with them, then they start looking around at the other 6 within the state. And it is amazing how far somebody will travel to get another opinion, and we're on the other side. We're getting second opinions. We're the second opinion person from somebody that's been evaluated, say, in Middle Tennessee. So there's more than just us. We're not allowed to punch a hole in your driver's license, but we're pretty close to it. It's nice keeping the community safe.
All right, so that did answer a question there. So you do send that information to the state of Tennessee, whether they pass or fail. And like you said,
only if they fail. If they pass,
okay,
then we will notify the state if they have been referred to us by the state for medical review. Maybe
Gotcha.
Somebody's turned them in, and so I could say, Will is a psyche driver, and the state needs to pull his license, and so they'll go, okay, and they'll notify Will. Then he has to then prove that he's a good driver, and unbeknownst, he has no idea who turned him in. So he gets turned in, so then he has to go through the process. So if we get somebody like that, we evaluate them, then we notify the state that they did fine. They were a perfectly fine driver. And I had one of those this week, and I had one from either side this week, one which could do fine, and the guy yesterday did not do fine. So, but typically, if they're from the doctor and they can do fine and they have a valid driver's license, we don't need to notify the state.
And you mentioned the physician. It is nice for us to be here because a lot of these physicians, they've seen these individuals for 20 years. And sometimes it's hard for them to be objective because they're their friends. And it's just great to have that third party. Obviously they're a physician, they're going to have an opinion, but gosh, it can become clouded if they're your friend or they're your neighbor. So it's just good for us to be that neutral third party that can come in without an agenda and without knowing the person and just make that determination that's unbiased, and then that way the physician has a better leg to stand on that says, look, things went great or things didn't go so well, and now here's the course of action going forward. So just a good thing to have the teamwork there with the physician and the family and us, along with the individual that we're assessing.
And then we provide them and the family with the information, like with the My Ride Tennessee, which is a Jackson local program that provides transportation for older adults. I think it's 65 and older. It's a very nominal fee for seniors within Madison County, and they've expanded to Henderson County and to Gibson County as well. I mean, for $2, they can get a ride round trip to a doctor's appointment, to a grocery store, to the movies, to see a friend. So it's a really nice service. It's a volunteer program, so it's a very dependable program. So you know that if I'm going to pick somebody up, I'm going to be at their house when they want you to pick them up, as opposed to waiting for the bus or some other type of public transportation service. So that's a nice service that's offered here in Madison County, and it's actually expanding. So we do provide them with that information.
And I mentioned this earlier too, but making a plan when something happens, whether it's young, whether you're learning to drive, or whether you're older, let's say you're an elder adult and you're 70 plus and you're thinking, it might be time for me to look at alternate transportation. We just can't stress enough today to talk to your doctor, talk to your family, talk to that person who is your confidant, who's in your corner, and make a plan. Because the earlier you make a plan, the earlier you discuss this, the better the outcome's going to be. We've seen both ends of the spectrum there. We a lot of times in life, we don't want to discuss the difficult things. We want to put it aside. We want to shove it in a closet until that closet just bursts open on us. And this is one of those things that if you can get out ahead of it, a lot of times there's much less heartache, there's much less stress, there's much less struggle between people and personalities if you can discuss it early and make a plan.
Well, touching base on making that plan, say if you had someone that's just recently had a stroke, no matter what age they are, and the doctor does have concern about them driving, is that a patient that could be sent over here?
Most definitely. And we encourage, if you've had a stroke or a new neurological event, not to rush into it. I mean, everybody wants to drive. They want to drive. It's amazing how fast. It is. But there's many alternatives. But sometimes we get patients that get sent to us a little bit too soon. So in those situations, we'll evaluate them and say, it's only been 3 months, or it's only been 2 months since you had your stroke. Let's revisit this, and we'll schedule them to come back and say 6 months or 8 months or whatever. So usually we like to see somebody 6 months to a year after they've had their stroke. That usually gives us a better time frame of a good brain healing that has occurred. And we get a better quality outcome. But yes, somebody that's had a stroke or a spinal cord injury or a head injury. We see a lot of people with head injuries. And usually we see them, it's been a year post their insult. The rare occasion somebody's been sooner. But again, it's not as cut and dry as somebody with Alzheimer's or some type of altered mental status that we really can't correct from. They just really can't take the training and the advice and making the corrective actions which are necessary. But with the stroke, we have some potential to learn.
And I would say we get minimum 5 calls a day. Someone just like we've been speaking of, who maybe their dad's had a stroke, or even a massive heart attack, and now he wants to go back to driving, and the doctor's saying we need to look at this. Or someone is aging, or someone has a child. There's so many situations that we could that we get calls upon. It may be someone who's had an accident, and the THP wrote in the report that they need to go through a formal driving assessment. So then they call us, and then we are happy to walk people through that process, because there's so many differing situations out there that are terribly confusing if you've never been through it. And fortunately, this is what we do for a living. This is we're here. We've done this for a long time. We work with local physicians, the state of Tennessee, law enforcement, all these avenues. And like I said, the phone call is free. We're happy to help you. We're here on Van Drive. If you need to stop by, it's 731-984-7640. That's our contact information. We're at a lot of events locally as well. Any type of aging events, any type of community health fairs, we usually have a representative there. So, like I said, feel free to give us a call. We'll do our best to help you and navigate through the situation that you're in, regardless if it is with your young son, young daughter who's learning how to drive, or if it's with your aging parent, or if you're the person in that situation that has some concerns about your safety.
But also one other thing, which I don't think Cody touched on, but maybe it did. But when you're making a decision as far as if you're going to be driving or not, sometimes you have to have some modifications to your vehicle. You have to have some adaptive equipment. You have to have some things that you might need to make it to where you can drive the vehicle. We're the guys to call to help you find out what that stuff is going to be. So what we encourage people is not to grab the internet, grab the catalogs, and start ordering stuff and putting stuff in which you may or may not need. Even if you do need it, you really need to learn how to use it and go through the proper procedures and steps to use it safely and kind of compliant with the state regulations as well.
So a lot of people as well will call and say, Cody, I don't know what normal aging looks like, and then translate that to driving. And, I just think about, I'm in my mid-30s, but a lot of times I walk in the kitchen and I think, what did I come in here for? Did I mean to go to the fridge, or am I going to get this, or am I going to get that? That's normal. We do that all throughout life. But getting lost in a familiar area that you've lived for 20 years, or, having unexplained scrapes, dents, different colors of paint on your vehicle, those are two big red flags. Confusing the gas and the brake pedal, those are two or three big red flags right there. So, yeah, it's difficult to see that in someone that you're around all the time, because it's easy to overlook things when you're with mom or you're with dad or you're with your child. But those are a few things that should alert you that something has changed. That's not a normal aging process. That's not a normal safe thing to do. And also, we get questions all the time about, what do I study? Do I have to come there and be and be perfect? Yeah. And we're not looking for perfect. I wasn't perfect driving here today, but I got here without any traffic violations. Didn't have any blue lights behind me. I was safe. I drove safely, and that's what we look for. We're not looking for someone to come in here and be perfect, because no one is perfect when it comes to driving, when it comes to life. But you should be able to operate a motor vehicle safely, and that's why the state of Tennessee, or whatever state you're in, grants you the privilege to be able to drive.
I'd like to go back to, you were talking, Woody, about the adapted driving equipment. Can you give him an example of a patient that's not an elderly or like a teenager? Why would we need adapted driving equipment put on a vehicle?
Well, one, probably a really easy one, if your right leg isn't with you anymore, so you've had it amputated, maybe you have diabetic neuropathy, and so you can't feel your feet. And so you can see them and you can look down and move. They move, but you don't know where they are. Two easy modifications. One's a left foot accelerator, to where it actually mounts into the floor of the car. You use your left foot to operate the accelerator, and then your left foot pushes on the brake. Sounds really easy. It's a very simple modification, but you've spent the past 60 years driving with your right foot, and your brain goes right foot. And so if you've got diabetic neuropathy, and that's usually a bad option, but say you have a prosthesis, or you're missing your right leg for whatever reason, training with that process can be rather challenging, especially in the surprise situations, where you have to quickly hit the brake or you have to quickly accelerate out. Your brain reverts back to its previous habits. Training and knowledge and stuff happens to everybody. And so there's been numerous cases of people running into things. We had a fellow in Brownsville. The left foot accelerator was put in the car without the proper training, and he ended up through the front door of a local bank. We ended up evaluating him, and really wasn't safe to drive at all. And it was one of those cases to where he had equipment put in a little prematurely. Hand controls are a big one. We do a lot of hand controls with spinal cord patients. Some with a diabetic neuropathy, because you just don't know where your feet are. So trying to teach somebody with the hand controls takes a little bit more training, a little bit more practice, because now you're not even using your feet. So even if you are a spinal cord patient, can't use your legs, your brain still thinks feet. It just takes a little bit more time, a few weeks of training. And then once we finish with the training, then they take a test with the state. Then the state gives them a new driver's license. So those are two big ones. So the hand controls and the left foot accelerator are two common ones with us.
So you're giving those patients still have hope that they may have that independence.
Certainly.
Because you guys are certified to do this type of
Right.
training.
We are.
And a lot of people out there think too, well, gosh, I'm disabled now. Let's say I've had a car accident and I can't use my legs. You can still drive. There is still potential there. If you have upper extremity functions, you can use your hands and your arms and have good trunk control. That is something that is possible. We see a lot of people who, they may have been injured 10 years ago, and they come in and they say, I had no idea I could still drive using hand controls, and that's a real option. It's definitely something we can discuss and look at your specific case, and it's something that really gives people tons and tons of independence. You think about opening up a door. We have a gentleman now, Woody mentioned earlier, we're going to the driver service station this afternoon.
That's right. Today's a day.
He has 2 young girls.
Hot diggity dog.
Hot diggity dog. And he has 2 young girls. They both play softball. And right now he can't drive them to their practices. He can't drive them to their games. He can't go to the tournaments that they go to because he hasn't got the restriction on his license, like Woody had mentioned, from the state. And thankfully he's been able to come here. We've been able to train him. He's doing great. And he is, as anyone could imagine, very excited to be able to drive again, to be able to have that independence, to be able to really get out and provide for his family and attend those events and be that active participant in his children's lives. And if it wasn't for hand controls, he wouldn't be able to do that. Very thankful for that and his ability to
well, the hand controls and his whole van will be modified. I mean, he's got it's from the ramp to the lowered floor to a special docking system for his wheelchair to a special seat belt. So it's a big deal. It's a big deal, and we're proud to be part of that process. And we encourage folks, to contact either us or somebody that's as qualified to help them through that process, because there's a lot of stuff out there, and some people will, if they lose their right leg, they just drive with their left foot. They cross it over, or they use a stick or a golf club upside down, or they have, Uncle Harry put in something. But definitely using somebody that's been certified and trained and familiar with the process and help them walk through, like Cody and myself, I think would be definitely a good option.
And you think too, this gentleman today, when he gets his license, he's 35 years old. So there's 40 more years of independence.
At least.
Okay. So
maybe.
if he lives into his 70s, which,
right.
Let's be conservative. He goes into his 70s, there's 40 years.
That's right.
Where if he doesn't have those hand controls, he's going to be dependent upon someone else, waiting on transportation. His wife works for a living. She can't take him to appointments. She has to take off work. So it's just it's a phenomenal opportunity for him, and he's over the moon excited.
Good morale boost.
As we're wrapping up our podcast today, one of the things I want the general public to understand is that you guys are available. You are certified through the state of Tennessee, and that the adaptive driving program is very unique and can touch base with you guys at what number, Cody?
It's 731-984-7640.
So, and you can also, if you're on Van Drive, you can see Work Plus sign. Just walk in, give us a shout, and come meet these guys. They're very, as you've heard their voices, they're very nice, and that's the way they truly are in person. And as we're wrapping this up, I want to say thank you guys for coming and talking with us. And this has been The Road to Recovery with Sports Plus. And thank you for listening to We Talk Health. We have 14 convenient locations to serve you, so if you're experiencing any type of pain or if you just have a simple question, you'd like to give us a call, you can call us at 800-427-0957 with 14 convenient locations. We have 5 in Madison County. That would be our Sports Plus North, South, our Sports Plus Aqua Therapies, Lift Therapy, and Work Plus Rehab. Yes, Lift Therapy is part of our Sports Plus, so keep that in mind as well. If you also are living outside of the Jackson area, we have Sports Plus Alamo, Brownsville, Dyersburg, Henderson, Humboldt, Lexington, Medina, Milan, and Trenton. So if you are living in West Tennessee, we have 14 convenient locations for you.